Thank you for joining us today. My name is Susan Evans, and I am honored to welcome you to today's discussion on mental health in honor of October as Mental Health Awareness Month. Today is for you. Our objective is to have a conversation with the presenters and audience. Please ask questions. They have incredible resources to share with you and words of wisdom. Thank you, Kensington Senior Living, for supporting these powerful educational events for our aging community. I was first introduced to Kensington in 2015. Our family made the difficult decision to move my father to Kensington in Northern California. He was living with Alzheimer's disease, and it was greatly impacting my mother's health. I did not want to lose both my parents to this dreadful disease. And Kensington gave my mother her relationship back with Dad as she joined him for lunch each day, and the struggle was eliminated from their time together, and Kensington took on the heavy lifting. Before we begin with introductions, I challenge each of you to think about 3 things you need from today. Please consider questions you want to share. We will discuss the importance of maintaining positive mental health, how to recognize signs of mental health concerns, and tips and resources for caregivers to provide meaningful support. Today, we will have a roundtable conversation with Monica Moore, Melissa Long, Tammy Anastasia, and Lisa Bricker, the Kensington Caregiver experts, and joined by Sarah Kim and Rebecca Harrison. Please join me in welcoming the Kensington team. Monica, Melissa, Tammy, and Lisa. Oh, it worked. Thank you all for coming today. What I'd like to do for the audience is if each of you could introduce yourselves and tell the audience a little bit about who you are. And why don't we start with that, and then we'll dive into a little bit about why we're here today and stress and anxiety and the challenges for dementia caregivers. Monica, can we start with you?
Yes, of course. Hi, good afternoon, good evening, everybody. Thank you very much, Susan, and for Kensington for having us be here today and for bringing this really important subject to people's attention and to really just be discussing this important topic. So I work at UCLA at the Alzheimer's Research Center, where we are a comprehensive care center where we focus on clinical evaluation, clinical trials, Alzheimer's disease and other related disorders research, and also caregiver support. I've been at the Easton Center for 10 years now and have been in this field of caregiving and Alzheimer's disease for over 20. So it's a great pleasure to be able to be here.
Thank you so much. And Melissa Long.
Hi, I'm Melissa Long. I am with Recreational Therapy Cube, and I've been a dementia practitioner for over 20 years. And so I provide one-on-one therapy and counseling to caregivers, and I hope that we can have an impact with you guys today because your mental health is just as important as the person you're taking care of.
And Tammy Anastasia, who has a new book out with really pretty colors on it.
Thank you. My name is Tammy Anastasia. Thank you all for joining us today. I have a private practice. I'm a dementia consultant, educator, and the author of Essential Strategies for the Dementia Caregiver in my second book that just came out 2 weeks ago, Dementia Caregiving and Personal History. And today we're hoping that we'll have an impact that we remind all of you who are caring for a loved one living with dementia how important you are. That a lot of times with caregiving, we get so lost in the caregiving process. We want to remind you that you all count and we care about you and we want the best for you. So I also facilitate several caregiver support groups, and I provide dementia caregiver counseling, dementia guidance, and care strategies for family and professional caregivers. So thank you all for joining us today.
And last but not least ever is Lisa.
Hello, I'm Lisa Bricker, and I consider myself a recovering caregiver. My husband Gary and I had a 15-year journey, and it took 7 years to get a diagnosis back from starting in 2005. And so it made an advocate out of me in the long run, because our journey, anyone's journey, is very difficult and stressful. Mental health is near and dear to my heart. And I'm really looking forward to this presentation today, and really appreciate that. I also lead a support group, and we are a mighty team of 3, and we work in greater Los Angeles area, and we are Alzheimer's and dementia placement specialists on a very personalized level, because we don't want anyone to feel alone on this journey.
And, I'm just going to say before Melissa introduces our first presenter, that it's not just a mental health challenge for the caregiver. It's also a mental health challenge for the patient or the person with dementia or the person that is ill that is needing caregiver support. So really, I think the mental health conversation is so critical for all of us involved, the entire team involved in taking care of someone, and it doesn't have to be someone that's older. If you're caring for someone, it's definitely a challenge for all parties involved. So with that, I'm going to turn it over to Melissa, please.
Yes, thank you. So I would like to ask Rebecca Harrison to join us. She is a licensed clinical social worker, certified dementia practitioner, and has been a psychotherapist for over 30 years of multicultural experience providing therapy services to individuals and families and couples. She has experience working in a range of settings, including nursing home, mental health clinics, hospitals, and hospice. She provides psychotherapy for depression, anxiety, life transitions, relational issues, and chronic illness. She's an extensive experience in assisting both individuals and their families facing challenges in dementia. She currently resides in Northern Virginia with me, and she is a huge advocate and support for our families out here. So welcome, Rebecca.
Well, thank you. Thank you for that introduction, and thanks for inviting me to the presentation. It's a privilege to be part of the panel today, especially as we recognize Mental Health Awareness Month. As you said, I have worked in the field of mental health for over 40 years, and in different capacities, long-term care, hospices, inpatient, outpatient units, and Alzheimer's Association. And I have just found the work very rewarding. My experience with dementia specifically is not personal, or I have not experienced it in my life, and I'm very thankful for that. But it was my working in as a professional, and that really got me involved in working and looking at caregivers and being focused as part of my care plans and my treatment as a young clinical social worker. And the moment that I really started seeing caregiver and the mental health and the importance of the caregiver's mental health, where we're at a clinical team meeting. We were gathered together as a part of the team. We were doing a treatment plan for an individual who had he had dementia. And we were all together, all the treatment team, we were all together, we were speaking. We had the family there, the wife was there, and she was the primary caregiver. And we were all about how we were going to support her husband. What resources that he would need. And so we were very much focused on how we were supporting her and supporting him. And this woman in the midst of this meeting she says, "What about me? Do I matter in this planning?" And that just resonated with me as she had the courage. And also it also spoke to her level of frustration about not feeling like that she mattered, and that her needs were being seen and heard. And that set me on the path of working to support the caregiver and their mental wellness. And each encounter that I have now is this lady, this person, she remains in my heart and in my mind. As when I'm speaking with a caregiver, I recall her voice, and that guides and directs me in saying, yes, you matter as a person. You are important in the caregiving process. So, and I think that's a really important focus, and I'm really happy to be part of the panel today to bring that back into to bring it into awareness. in the start of my professional and training and experience, the clinical setting, the focus was on the objective experience of the caregiver. We were focused on the burdens of the caregiver, resource management, daily needs, but as we evolved, we got smarter. In addition to focusing on the objective burdens, we became more aware of the need to the subjective burdens, the emotional strain of caregiving, the impact of stress on the caregiver, the mental health, the mental wellness, the importance of the emotional and mental health of the caregiver. And this is what she was saying to us in that moment at the beginning of my professional career was, what about me? It wasn't clinically, we didn't focus on the caregiver. It wasn't until 1986 that we actually coined the word in clinical settings to focus and to recognize caregiver burnout. And that was coined and labeled. So we became more clinically focused on that. And it was, but before that time, we knew about burnout, we knew about caregiver burden, but it was focused more on the professionals providing the services. And then in 2019, the World Health Organization actually gave an ICD code. They recognized, and they call it caregiver burnout syndrome. And caregiver burnout syndrome was defined as chronic stress, not managed successfully. So at that point, we really began to be more focused, community education in the community, in our treatment of mental health, in our awareness of working with caregivers about the mental health challenges and how to provide support to the caregiver. So as I continued my work in working in my support of caregivers, it was listening to their stories and noticing their patterns of thoughts and their emotions, their behaviors. And as I noticed a pattern of caregivers as they were speaking with me, and it was about not feeling okay. It was not feeling okay about as they were caregiving, they felt like they were failing as caregivers because they had these intense emotions, and they were aware of all some thoughts and some feelings that they were having, and yet they were so fearful of actually expressing those thoughts, giving voice to how they were feeling, because they were really, they would say, I'm just so scared of being judged. I'm scared of being criticized. I feel like it isn't okay. It isn't okay for me not to be okay. And I'm having all this emotion and feeling this, but I don't know that that's okay to feel like this. I don't feel. So as I see I see that now, as even fast forwarding all these, that caregivers today in my practice, I'll see them, they'll come and see me and they'll say, I really need you to fix me. I need you to make this better. I would like you to just take away this grief, because I don't feel like that I'm functioning as well as other caregivers, that I'm not happy. I see the ads on TV, I see the commercials, I go to support groups, I go to trainings, and everyone seems to be doing so much better than I am. And I just don't feel like I'm doing a good job as a caregiver. And a case example of this is a young woman I worked with, she and her husband, and he was an early onset. And she called me one day, and she was sobbing, and she was in the parking lot. She had just left the support group, and she was really upset. And she said, oh, everyone seems to know how to be a caregiver but me. My heart is just broken into 1,000 pieces. And yet I see other people carrying on and going and showing joy and happiness, and I just don't feel I'm okay. So she had all these emotions about what was it like for her subjectively as a caregiver, and what was happening for her, and having to attend to that. So is it okay not to feel okay? And that was one of the questions around the panel today. So what I wanted to really look at, what does it actually mean? The definition, if we're actually let's talk about what the concept is of being okay. The working definition of good mental health is as a person, if for a person or a caregiver, the definition of good mental health is how we as individuals cope with stressors, life stressors, and we manage our challenges and how we bounce back. Good mental health is characterized by resilience, emotional stability, healthy relationships, as well as a sense of purpose and optimism. Good mental health is defined as our ability to cope with stress, adapt to change, while simultaneously maintaining a healthy lifestyle. We're expected to function productively, engage in daily activities, and maintain our relationships. We are expected to be able to recognize, understand, express our emotions in an appropriate ways. And that's a lot. I mean, that mental health, it covers all the areas. And it's very difficult. And it's a lot of stress on anyone, and especially caregivers that are carrying the burden of caregiving, to measure themselves and think, that's what it's like to be okay. I'm not okay. I think it's important to understand that good mental health is a dynamic process. An important point that I want to make today is that mental health is dynamic. It's ever changing. It is not, it doesn't stay permanent. Good mental health is not the absence of emotion. It's not the emotions of stress or grief or sadness or resentment or anger, but it's a management of these emotions. The key to good mental health, of being okay, is to experience the full range of emotions. As we're told to do in physical therapy, we're saying the full range of movement. We want a full range of physical movement. Well, we want a full range of emotional. We want to be able to identify, we want to understand and accept our full range of emotion. On some days, we may feel more acutely the grief or the loss, the sadness, the anger, the resentment. But whatever our feelings are in any given moment, we want to be able to understand, identify, understand, accept what is happening for us. The health is in the balancing of these emotions. We're holding, as caregivers, we're holding these very big emotions. On one hand, we may have love and hope, and in the other, we may have grief and despair. And anytime we're holding both of these, and at any time, our well-being can tilt on this in this scale, and it can tilt in one direction or the other. So we may feel more down, and on the scale, we may feel more down, or we may have a balance and being able to hold the joy and the happiness and the connections and the positive emotions that we're feeling as caregivers. And at the same time, there's the grief and the loss, maybe some anger, resentment, other emotions. So we're holding these, and sometimes in some days, these scales can get tilted. So how do we manage to bring back into balance our emotional and our mental well-being? It's to remember that it is the balance and not the absence of these emotions. So where are we on these scales? Are we holding both positive and negative emotions simultaneously? So we're able to do that, and that's where the mental health, the mental wellness will be. As I said earlier, mental health is dynamic, and caregiving is an emotional roller coaster. One example, and I call it, I'm going to give a case example of a person, and I call it my tuna fish sandwich. It's an example of being able to hold both the emotions of caregiving. I had a client, and she and her husband, I had worked with them as a couple, and he had been diagnosed with early onset. And they had found their balance. They were holding the diagnosis, the life, the management, and it was relatively balanced, and they felt like they were doing really well. And I got a call from her, and she said, I'd like to come and visit. I'm not doing so well. So when she came in and she sat down and she said, I am so angry. I am so upset. I'm out of balance. I'm irritable. I don't want to do anything. I have no idea what is wrong with me. And as we sat and we talked, she got curious about when did she start experiencing this shift in her balance. And she said, well, it started last week. I had an appointment at lunch, and my husband, the backstory on this is that he had been losing weight, so they were really focused on nutrition. And so she said, so I had an appointment at noon and I needed to go out. So I made my husband a tuna fish sandwich, and I put the tuna fish in the refrigerator. I told him where the sandwich was. I told him that it was for his lunch, and I went to my appointment and I came back. And when I came back, I found the sandwich in the fridge. And she said, I went to him and I said, why is the sandwich in the fridge? Did you not eat lunch? And he said, I didn't remember you telling me about the sandwich in the fridge. I didn't remember to eat lunch. And she was saying, whoa. And as we got more curious about this, she was able to identify what this event, how it landed on her. It was, for her, it was the loss of independence, for her to be able to go out and leave him and run an errand and have the independence. It was also a marker of her husband's ability to participate in his own care. So that was a big loss for her. And it was also, both of them experienced that this is what they were looking at into the future. So there was that sense of, there was a piece of hopelessness there and of being overwhelmed. So she had just this cascade of emotion triggered by the tuna fish sandwich. And she has a great sense of humor. And she said, wow. And that was just a tuna fish sandwich. And I felt all of this about a tuna fish sandwich. And she was able to really to focus and to help bring her balance back. And how was she able to do that? She was able, and I think that it, not just for this person, but for all of us, is that in order to maintain our balance, we really need to ask for help when we are feeling this off balance, to be able to work to identifying our feelings. We want also to be heard that these feelings that we voice are okay, that it's okay for us to feel what we're feeling, and to receive encouragement, and to have a sense that all of our thoughts and our emotions are really acceptable, that it is okay not to be okay. And I think that's the message that I would like the caregivers that are listening, and anyone else that's listening, that we're not going to be okay all the time. And that's okay. That we're going to be balancing out an awful lot of emotions, and that we give ourselves compassion, a lot of self-compassion, as we're on this journey as caregivers.
Well, clearly you've made an impact on Melissa Long, because when we first were kind of coming up with this whole plan, that was what Melissa said. It's okay not to be okay. But I just want to emphasize, you said something to me that just went to my core. And that was, I was always protecting my father with Alzheimer's from the stigma. I didn't even think about the stigma about me or my mother or the others. And it breaks my heart to think people think that they're not doing enough. That just breaks my heart. But thank you so much. Monica, you're on.
Yes, thank you again, Rebecca. I really appreciate it.
I could listen to you all day.
Yeah, what you said, it was really great. I'm just going to chime in. I liked the one part, I actually wrote it down, where he said, it's not the balance of, it's the balance of, not the absence of feelings. It's like, isn't that, I thought that just really like that's what we all juggle with, right? We juggle with feelings, and it's the balance, not pushing them down or getting rid of them. So thank you so much for that, Rebecca. I'm very honored to be able to introduce our next speaker. I'm Dr. Sarah Kim. Dr. Sarah Kim is a geriatric psychiatrist over at Cedars-Sinai Goldrich Center for Alzheimer's Disease and Memory Disorders here in Los Angeles. So while they might be our crosstown rivals in some ways, we're very happy to be able to collaborate with such wonderful professionals. So Dr. Kim, I'll allow you to introduce yourself a little bit more.
Thank you, Monica. Hi, I'm Sarah Kim. I'm a geriatric psychiatrist. I work at Cedars. I initially became interested in psychiatry because it is a very unique field in medicine where really no blood tests or CAT scans are actually needed to evaluate and make a diagnosis. Most of the time, a medical psychiatric diagnosis can be made by just talking to the patient and getting collateral history. So being genuinely curious about the patient, being thorough in exploring the history, and also being a good listener is very important in psychiatry. And that's what's fascinating about psychiatry. It's also the only field in medicine where the interview can be both diagnostic and therapeutic. You talk to the patient and the family, you formulated your diagnosis of the patient's illness, but during that talking, you can also provide therapy and treatment for that very same illness that the patient and the family members are struggling with. And I think this concept is even further highlighted in dementia care. Our patients and caregivers are battling with a disease that does not have cure to date. However, you can still make a difference and at least elevate the burden of the disease by just talking to them and sometimes just lending your ears. So that's what I like about my job. And another area of interest for me is to really promote awareness of how common the psychological behavioral symptoms of dementia are. I believe it is not only important to just try to find the cure for the actual disease dementia, but also equally important to be aware of the psychiatric problems that come almost linked hand in hand with dementia. So you don't miss the opportunity to treat what is treatable, and better management of these psychiatric problems can also help prevent incident dementia as well as slow down the progression of dementia. So I have a brief presentation I wanted to share today to emphasize the importance of mental wellness in dementia. I'm going to share my screen here. Can everyone see my slides?
We certainly can.
All right, so mental wellness and in dementia care. Mental health problems are common. About 30% of general population in the US struggle with insomnia. Almost 20% of the population experienced at least a single episode of depression in lifetime. And over 30% of adults are affected by some type of anxiety disorder during their lifetime. But what's shocking and scary is that less than half are engaged in treatment.
Dr. Kim?
Yes.
Your slides are not advancing. There you go.
Okay. All right, maybe we'll do it this way. So mental health and memory disorders, they have a strong relationship. Insomnia is common in neurodegenerative disorders, dementia, but poor sleep has also been associated with increased beta amyloid plaques, tau pathology, brain cell damage, and inflammation, all the changes that the brain goes through when they develop dementia, like Alzheimer's disease. Depression is also very common in dementia, and depression can also be a reaction to early cognitive deficits as well. Depression is associated with increased risk of dementia, and sometimes depressive symptoms can mask dementia, what we call pseudo-dementia. It can present like dementia when it's not dementia, but actually just depression. Anxiety is also common in dementia, and it's defined as one of the factors increasing risk of dementia. So I just want to emphasize here that mental problems and mental health problems are common in dementia, but dementia can cause all these mental health problems, but these mental health problems in return can also increase risk of dementia. So they have bi-directional relationship.
Can I ask a question?
Sure.
And when my father felt like he knew that things were not normal, that he was worried, he took himself to the neurologist. And then when they started to progress, that they felt something was wrong, he became even more depressed and more anxious. Do you think that when you understand that the disease, that you actually have dementia, do you think that exacerbates the decline?
Yes, yes. So when you are aware that you have dementia, so depression can manifest as an early reaction to the diagnosis of dementia, or when they first start to realize that they have, some cognitive issues. And if that depression goes untreated or undertreated, that can, a lot of the studies have found that that can lead to a faster progression of
Yeah.
dementia, of the actual cognitive deficits as well.
Thank you.
So first of all, let's talk about sleep, why sleep is so important. So sleep is divided into 4 stages that we all go through multiple cycles of these 4 stages when we sleep. It's actually in the deep sleep stages 2 and 3, that our brain literally gets a good, nice wash. We have some fluid wrapping around our brain. I love this picture, called cerebral spinal fluid, that our brain sort of produces and sort of sits on. And these fluids circulate throughout the brain, and it removes all the plaques, the amyloid plaques, the beta plaques, the protein buildups, all the toxins. So it gets a nice wash only in deep sleep. So if you don't get enough of the deep sleep, your brain doesn't get this wash. Hence, the protein, the plaque buildups can lead to incident or progression of dementia. Just to emphasize again, the bi-directional relationship between depression and dementia. Depression roughly doubles the risk of developing dementia, found in many studies. And depression is just so prevalent. About 40 to 60% of dementia patients experience at least one time of depression throughout the course of their illness. And it's not just found in population studies, but they found actual neurobiological mechanisms underlying how depression leads to dementia. I'm not going to go through each and every single box, but you can just get the concept. Depression leads to inflammation, release of toxins, release of stress hormones, which can cause all the small vessel changes in the brain, inflammatory changes in the brain, and also buildup of toxins in the brain that can lead to dementia. So they have a very close, strong biological link to.
Is there any age associated with this? I've heard that certain things can start developing in your brain as young as 30. If someone, you have a child or someone that is depressed or is challenged with that, can that lead to a big
That's a very good question. So a lot of the trials and studies have looked at whether early life depression has any association with developing dementia later on. We haven't really found any substantial data on that, on early life depression, but studies have found that middle age depression, late life depression, that does have strong association with developing and faster progression of dementia.
And we can talk later. What Rebecca touched on is, we're all comparing ourselves to other people. Like, it broke my heart that the caregivers don't think they're good enough. And that lady said, "What about me?" I just worry about all this going on and the influences for our younger kids. That worries me a little bit.
Yeah, exactly. So I chose this topic just to highlight how our patients, are the recipients of our caregiving, struggle with these mental health issues and psychological stress. But I also wanted to highlight this can very well affect the caregivers too. Over 70% of the caregivers reported that they have stress, period. They are under stress. About 60% have indicated that they have high emotional stress. About 40% struggle with depression, 44% anxiety, 47% sleep disturbances, and 40% have indicated that they're isolated. They feel lonely. They're socially isolated. They have also reported 35% of the caregivers also reported declining health. Most of these really involve around the weakened immune system, probably from lack of proper sleep, nutrients, rest for both the body and the mind, worsening of chronic health issues, any chronic diseases that they already have, they have worsening condition of that. Caregivers are also more likely to smoke, have hypertension, and have diabetes. And about 30% have reported that they delay or fail to take care of their own health, to go to the doctor's appointments, to go for follow-ups or imaging, or even take medications. There's also financial burden associated with caregiver stress. Nearly double the caregivers of dementia patients have reported that they pay nearly double the out-of-pocket expenses compared to other caregivers of other diseases. Most have reported that they bear most of the 70% of the total lifetime cost of dementia care. 40% had to reduce their work hours, and 20% had to even quit their jobs. And all of this leads to healthcare impact on the healthcare side too. There's lower quality of life for both caregiver and the recipient, our patient. Hence, there's higher use of acute care services like the emergency rooms and acute care hospital settings. There's increased likelihood of institutionalization, meaning hospitalization and placement in nursing facilities. And both the caregivers and the recipients have found to be involved in more potential harmful behaviors. So recognizing mental health problems in our recipients, our patients, is important, but we also have to recognize that they can happen to us, the caregivers, too. So I just wanted to discuss some tips how to take better care of our mental health, because as we found out, our caregivers don't really seek medical attention as much as they should be. So then I wanted to begin with, then what can we do at home before we go see a doctor, see a psychiatrist or a psychologist or a therapist. So sleep hygiene, something very easy, simple to do. Taking power naps are okay. Carve out some time during the day, less than 30 minutes, even for 10 minutes or 15 minutes. Carve out some time so that you can replenish your energy and take some power naps. There is no such thing as perfect number for sleep. A lot of people ask me, what's a good hour for sleep? It depends on how you've lived your life and how you function. I just want to stress that quality is more important than the number of hours for sleep. So keep the environment quiet, dark, comfortable temperature, reduce stimulation, control any factors that can further disturb your sleep. If you have sleep apnea, get evaluation for sleep study, wear your CPAP mask. If you have pain, talk to your doctor about that, or any using the bathroom frequently at night. Keep your sleep schedule consistent. Use the bed only for sleep. Get out of the bed if you can't sleep, and go for a walk, listen to music, sit down and read something, and then come back to bed only when you're ready to try going back to sleep again. Exercise and stay active during the day. Do some relaxing activity before bed, like yoga, meditation, listening to relaxing music. There is a 10-3-2-1 rule, like Insomnia 101, the basics of insomnia, and it goes like this: no caffeine 10 hours before bed, no food, including alcohol, including drinking, 3 hours before bed, stop working 2 hours before bed, and no screen time, no time on the phone, iPad, Kindle, TV, whatever, 1 hour before bedtime. So of course, it's always easy for me to say and much hard for our caregivers and the patients to do this at home. But I just really wanted to introduce you to the idea that we don't necessarily always have to see the doctor or take medications for sleep. There are other simple behavioral modifications we can do to improve our sleep quality. Anxiety is common in our patients with dementia, but also common in caregivers. So anxiety, it goes like this. The numerator is how likely you anticipate the danger or the consequence or the worst case scenario to be, multiplied by how awful you anticipate the consequence to be. The denominator is how well you believe you can cope with whatever the consequence. And then the external rescue factors or coping tools that you have. So let's just take a moment to think about this and recognize that our anxiety, if you break it down, it comes from how you imagine the worst case outcome to be, divided by how you can actually handle and cope with whatever the outcome is. So I think just recognizing that sometimes our anxiety is not really factual based or reality based, but it's our brain likes to play tricks on us. It's how much we anticipate and how awful we anticipate things. And then forgetting about our resilience, our strength, and our support that we already have. So trying to minimize the numerator, the ones on the top, and trying to remember and utilize and expand the denominator, the ones at the bottom, that can actually help greatly reduce anxiety.
And give you better balance.
And just some tips, some guidelines on reducing anxiety. One, be honest with yourself. Accept and acknowledge how much you can do, how much you're capable of doing, and what you want to do and what you don't want to do. So first of all, be honest with yourself. Two, challenge your thoughts. Are they really factual or are they just anxiety driven? So do some fact checking and challenge your thoughts. Three, look on the bright side. Try to think positively. Four, focus on what you can control. So break it down and do what you can do. Five, practice mindfulness by being aware and intentional. Six, take action through value-driven behaviors. Think about what's important to you, why they're important, and expand on that. Seven, gratitude journal can always be helpful to remind us to stay on track and really reflect on the day and think more positively about the day. Eight, find new ways to connect with others and build your support network. Nine, physical activity is always important. Infuse your day with physical activity. So these are some tips so how you can decrease the numerator and increase the denominator. Next, I want to talk about depression because depression, it's not just feeling sad. A lot of people tell me, I'm not depressed. I don't cry. I don't feel sad, which means I'm not depressed. But depression can be expressed in many, many different ways. If you just feel empty or numb, that can be a sign of depression, guilt, pessimism, helplessness. Or, depression can also express itself through physical complaints. My stomach hurts, my head hurts, I can't walk anymore. Depression can mean many, many different things, and it can be expressed in many, many different ways. So I just want all of us to be aware that depression is not just feeling sad or crying. It can even be anger or irritability, being snappy, being short-tempered. That can also be a sign of depression. So look around you and look at yourself. Look for any of these warning signs. If you feel sad, if you have crying spells, if you notice that you're actually becoming more irritable, or people to say you're being snappy, if you start to lose interest, you find yourself not doing things that you used to love doing, enjoy doing. If there are any sleep disturbances or appetite changes, you feel low energy, fatigue, you're withdrawing yourself from social activities, you're isolating yourself, or if you just feel numb, don't feel anything. You feel like you're stuck in the tunnel and don't see any light at the end of the tunnel. If you feel hopeless and helpless, or even worthless, any feelings of guilt, or change in your focus, concentration, those all can be signs of depression. And like I said before, it doesn't always require medications for treatment. Work on reducing stress, work on reducing anxiety, exercise, keep healthy, well-balanced diet, increase your social engagement and social support, work on improving your sleep hygiene, 10-3-2-1 rule. There are many things that we can start with today if we notice any warning signs of depression before we go see a doctor or take medications. And that's all I prepared for today. I just wanted to increase awareness of how common psychological symptoms are, not just in dementia, but in caregivers too, and hopefully decrease the stigma of psychiatry, the barriers to people coming to see a psychiatrist. And there are a lot of things you can start on your own today to promote mental health wellness.
I want to remind the audience that you will receive a copy of this valuable presentation conversation to share with friends and family, because I think the more we can share this with people that we may not even think need it, the better that we can do. Monica, I'm going to go ahead and start with you with our questions that were submitted at registration. Oh, where'd Monica go? Oh, Monica's not there. Okay. I'll go ahead and start then. She's there, but she's not. I'm going to start with this question, and we can start, Rebecca, if you want to start with the answer, and then anybody else that wants to join in. Oh, Monica, you're back. You can go ahead and ask your question. Oh, she's not back. She must have, do I have an internet problem, or is it Monica?
I think it's Monica.
Okay.
I think
And
the
that-
Zoom is frozen.
And actually, I'm going to skip this question, because this question is what Rebecca spoke about.
Yeah.
It's okay not to be okay. And
Yeah.
Rebecca, I'm going to listen to your conversation so many times, because you hit home on so many points that everybody needs to hear about, and that's balance. It's okay to not be okay. And I still think we need to write a book, what about me? And it breaks my heart that so many caregivers don't think they're doing a good enough job. Are you back, Monica? Not really. Okay. Melissa, you can ask the next question.
Yeah, so our next question that we got was, can you discuss ambiguous loss and the longest goodbye associated with dementia? So, Rebecca, if you'd like to, I know you've done a lovely presentation in the past on ambiguous loss, and maybe Dr. Kim can talk about the long goodbye. But go ahead.
Dementia is full of ambiguous loss. And ambiguous loss is, the definition is that there isn't a clear beginning and an end. There's no marked loss. It's not like you have a moment like a death. And it's so in dementia, I think we lose our person bit by bit by bit. And so we're always grieving. One of my clients told me, she said, I feel like dementia is death by 1,000 paper cuts.
Oh.
And so the loss is, it's an example of, for me, and is when you're a caregiver and your person doesn't remember your name, that's a tremendous loss to you. And yet, if I were to tell, if I were the caregiver and I was telling someone, no, you may not, others may not understand how significant that loss has been for you. And so no one's going to come, to your door with a casserole dish and say, oh, your husband can't remember your name. Let's recognize that loss. Let's mark that. So I think that's what makes the long goodbye. It's a constant goodbyes. You're losing bit by bit by bit that person that you're really caring for and caring about. And also ambiguous loss is defined as being emotionally absent but physically present. So my person is going to be here physically, but not necessarily emotionally or behaviorally. And so that is an ongoing loss for me. So I'm processing loss on a daily basis. And so I think that makes the dementia extremely exhausting emotionally for the caregiver. It is a long goodbye.
I just have to say, and thank you, Rebecca, for your words. All of them just have impacted me, and brought, I lived with this for 15 years, and my husband passed away over 5 years ago, and I'm still recovering. And it's the tuna sandwich is loss, the isolation and loneliness. And I call them gut punches as we go along. Those are the ones we notice, and they're more impactful than we think they are. And I used to picture myself in a phone booth on the street with everybody walking by me. They're all going on with their lives. And there you are, kind of like, how do I, you don't, it's also a metaphor of there's how the ocean is how far the water was under or over or here. So it's all a matter of, it's all there. And you're on this roller coaster ride doing the best you can. So I just had to share because I believe that a lot of the people here today can relate to what I'm saying. So thank you so much. We could be here for 2 more hours.
And I'd like
Thank
to
you,
add
Lisa.
to the ambiguous loss too. It's the person, it's the relationship, it's the shifts in the relationship, it's the shift in your life, it's the shift in dreams that you once put on hold. It's the residual of, what I didn't do pre-dementia and now I am in this situation. To coin a term, a client of mine termed it, I'm a married widow. She felt she was a married widow, and this is how she explained the ambiguous loss. And I think that term is lovely. It just identifies it for spouses beautifully. So, it's the big picture. It's everything: the relationship, the person, the dreams, the life we were planning ahead, the life we put on hold to plan ahead. And I think, and that this loss is a reminder every time there's a shift, every time there's a progression, every time I have to say no to something that maybe I wish I could have said yes to, right? So when we think of ambiguous loss, it's the dynamics, to use Rebecca's term, that the whole dynamic of the relationship, yourself, even yourself, you lose parts of yourself, and there's a loss in that as well. But the ambiguous loss is grieving the loss while they're still alive, grieving the loss while they're still physically present. But I just wanted to expand on it a little bit more, that the loss is profound, actually.
Dr. Kim, do you have anything to add?
I mean, I can resonate with all the words already said by Rebecca, Tammy, and also Lisa. One thing I want to add, I mean, yes, the loss is profound. It's every day. It's very palpable. But one thing I do suggest to the caregivers, just for a shift in perspective, sometimes it helps to think about it as a change more than a loss. Because if you think about I'm losing something every day, of course, it's grief, and that can be very depressing. And sometimes, if it can be helpful to think of it as, oh, my spouse is changing every day. I'm meeting somebody new, somebody different, somebody changed. Instead of just thinking about I'm losing this part and losing this part and losing this part. So that could be the change in perspective can sometimes be helpful.
Thank you.
Not an easy thing. Someone said to me once, your dad's mind is gone, but his heart is still there. And that made me feel good. But still, when Tammy and Melissa and Sarah and Rebecca and Lisa, Monica were sharing about this loss, it's just such a struggle, because there was times that I would literally pray that my dad would pass. It was time. He was gone. He wasn't my father anymore. And then little did I know that, man, that was one of the hardest ever. So this is not easy.
Well, I'm just going to bounce off of Dr. Kim. And actually the theme of my second book that's here is all about how can we use this journey as a way of even healing old wounds, healing losses, and dealing with losses. So Dr. Kim, thank you for that. I won't say much more about it, but this was the primary reason why I wrote this second book, is how can we make some significant and meaningful, not only changes, but changes in the relationship, changes in how we are affected, how we take care of the person living with dementia. So I absolutely agree, it's loss, but what do we do with these feelings, and how can we use this also as a way to empower ourselves, but not only empower ourselves, empower the ones we're taking care of as well, in our care, in our language, in our ability, our presence. So I won't say much more, but just wanted to say that was actually a lot of the reason why I wrote this second book.
I so agree. That is the opportunity to heal and to grow and to find purpose in the journey.
Yeah. And it's tough. It's a roller coaster, But as we mentioned today, your feelings count. All your feelings count. And we have to be comfortable with our feelings, and how can we use those feelings to benefit us and learn and grow and still feel, right? We got to give ourselves permission to feel what we feel, not with judgment, not with criticism, but what are my feelings trying to tell me? And then what's causing me to feel this way? And what do I need to do different to feel better?
And Tammy, I think too, lots of people, caregiving really feels like such a solitary role. Like people are in this and they feel like they're the only ones who are doing this. And obviously from the work that so many of us do, we interact with a lot of people all the time who feel like they're the only ones doing this. And even in one of my support groups just today, a woman said, "But look at all of you, you're all doing so well." And she felt that she was the only one who was really struggling. And I said, "Oh, I'm sure we could talk to everybody here about how everyone is really struggling through this because of was it the losses, the challenges, the changes, etc., all of that." But we look at other people as saying, "Oh, wow, look at Lisa. She's got her stuff together. She's doing so well." But inside, Lisa really might be dying. And so understanding the importance of bringing this topic of, to the forefront to have the discussion about the numbers that Dr. Kim was showing, the stories that Rebecca was showing about, really the impact that how mental health is impacted by caregiving, and in so many different ways. It's not just depression, agitation, anxiety, apathy. All of those are impacted by what people are living every day.
Yeah, and not compare yourself to others. You don't know what others are really thinking and feeling, right? And that is so common. And then the worst thing is your self-judgment about it, is your criticism about it, right? How do we make it safe for you to feel the feelings? No judgment, no criticism, but feel the feelings. And don't assume what you see on the outside is really the way it is. Don't compare. Each and every one of you, every person listening to this today is special in your own way. And you deserve to be kind and to honor those feelings, because we live in a world that is very much stigma and judgmental and critical. And the best gift we have is you. And you need to know you're a gift, and you need to know your feelings count.
Yeah, so Tammy, I think we live in an Instagram world. So
Yeah.
what people could be presenting in support group is their Instagram life, and we're not seeing the other things they're struggling with. So it's really important not to judge. There's also a research study that I really love that gives a great way for us to kind of picture the isolation and depression that Dr. Kim was talking about, that with prolonged isolation and depression, it's actually the equivalent to smoking 15 cigarettes a day. That's how much it affects your body physically. And it hits home for me when I hear that, because we know it, as kids in school, we get told how damaging it was to smoke. And so that really hits home of why I don't want to go to the support group. You know what? I need to go because I need to be socializing with people. And we saw through COVID the impact COVID had from being isolated on all of us. So I think it's really important. As much as we may not want to do things, we need to do them to get out and be around people, even if it's through Zoom.
Yeah, right.
So I would like to end with one 5-letter word that I don't think we've talked about a lot, but I'd like to kind of end with that. And I think you could all add some really good advice for our audience and for the people that they share it with. And the last thing is guilt.
Mhm.
So Rebecca, you want to start with guilt?
Well, that's a big one. Guilt.
I know it's a big one, but I feel like we all kind of touched on it with so many different things. I was going to say it, but I decided to save it for the end. Like I felt guilty when my dad died. Like,
Mhm.
why did I have that feeling that it was time when he wasn't my dad anymore? And so I'd love to hear your guys' thoughts, everybody's thought on guilt.
Well, I think it's a really normal emotion. And I sometimes wonder if we are quick to label our emotions as guilt when they might actually be grief or sadness. Because if I say I feel guilty that I'm thinking that I would like my dad to die, or he would in some area like that, then maybe it's more sadness that your dad is going to die. And we have to be really careful of how we see guilt, because it's a great place to hide out a lot of other emotions. And I think we honor it as an emotion, but we be careful and be curious about it. What is it really meaning for us?
Oh, I love that.
I want to say that I made a promise to myself along the way to give myself permission to know that I was doing the best I could. And I made a promise to never judge another person's journey because we can't judge that. It's an individual journey. But the most guilt that I felt was when I ended up having to move my husband into you know, a community. And that was the hardest. I always say to families, that's the hardest decision you'll ever have to make. It's a big one. And so guilt comes with the territory of having to step into another human being's life and be responsible for it. And that's a big job. And to really forgive yourself and be kind.
And I'll piggyback off of Rebecca too. I completely agree that sometimes guilt is the easy place to go to because I'm not ready to deal with the underlying emotions and the feelings, right? The other thing about guilt is, where's the guilt coming from? Is it self-imposed expectations? Is it family messaging? Is it cultural messaging? And start questioning the reality and the truth of those questions that make you, those messages that make you feel bad, right? One thing we have the power of is what we say to ourselves. And guilt is probably one of the major factors that I deal with in my private practice all the time. And like Susan, it breaks my heart. These people are just so loving and kind and caring and can't do enough for the loved one. And then this guilt consumes them. So I'm going to just ask everybody to rethink the messaging because you deserve a lot more of unconditional love that you're giving to your loved one. You deserve to give that to yourself too. Just because it's a bad day or we did something and it's a hard decision, doesn't mean you're a bad person and that you've done something wrong. Quite the opposite. Loving somebody actually requires us to make some very difficult decisions. Please try not to label it as guilt.
And Tammy, I'm gonna piggyback off of what you have to say. I think people also get into this role, obviously not by signing up for it.
Right.
This is something that people are literally doing, flying by the seat of their pants. They're just doing whatever decision they feel right is at that time. And people say, "Oh, I wish I knew. I wish I knew better. I wish I knew this." But then I remind everyone that you didn't sign up for this. You didn't take a class. I use the analogy of like the first time you ever filed your taxes, did you know what to do? Like, no way, that was big and overwhelming. And it's like, what am I doing? And what can I claim and what can I not claim? And you're sort of just grasping at straws. Then now you're stuck in this role that is ever evolving as well. It's like once you figure out how to file your taxes, you're like, great, I've got this. I can do it next year. Okay, now I've got it. You can streamline it and make it faster and make it better. But with caregiving, it's always a little bit different because it always changes. Even if you cared for your parent 1 year once and now you're caring for a spouse. It's like the relationships are different. So again, don't feel beat yourself up for the fact of like, I should have known better. It's like, no, you shouldn't have. That's why there are professionals like all of us here. We're the people who are going to help guide because we're the ones who are supposed to take that off your plate because we know this stuff. This is what we face every day. So really reach out to the resources to help you alleviate maybe some of that guilt and the pressure that you put upon yourself.
Yeah, and I think another really good piece behind it too is that you have this expectation like you're a robot and we're not robots and we're humans and we're going to make mistakes and emotions are going to get involved and we might have an outburst and get angry and it's okay. Like we said, it's okay to be okay with what we're presenting in that moment. And so we're not perfect. We're humans. And so give yourself some grace. And like Monica said, reach out to the professionals who might have a better understanding of what you're going through on the resource level, and we can get some support out there to you because you can't do this alone. This is a marathon, it's not a sprint, and you need as much help as you can get and whatever that may look like for you.
And the dementia journey is a learning by doing process.
Yes.
Even us We are
Yeah.
still always learning. We learn through you, you learn through us, and it's just a beautiful way of just supporting you and what you're going through. But I think, you got to give yourself permission, learn by doing. Something doesn't work out. What can I learn from it versus spending all this time? I blew it. I should have known better. It's all about giving yourself permission to learn because it is a learning by doing process.
Anybody have anything to add, since we've gone over, and I just made a note that we're going to put this entire webinar in our newsletter for,
Yeah.
I think the information here, I can't imagine anybody that this is not valuable information for. Dr. Kim, do you have anything to
Yeah,
add?
just one quick thing to add about guilt. I completely agree with and really appreciate what everybody else said. Guilt is rather used very ambiguously or broadly in this situation. It should be normalized because no matter what you have done, you're always going to feel guilty. One thing I want to suggest, because it's all about balance, right? So if you feel guilt, I feel guilty. I didn't read my mom bedtime stories every night. I should have read her some bedtime stories like every night, but I didn't do it every night. Instead of feeling guilty for the nights that you didn't, reminisce and think and, think about the times that you did something for her, that you did, read bedtime stories to her. If you feel guilty about sending your spouse to a facility after some time, then rather than feeling guilty about that, reminisce and think about the years and the month and the times that you guys got to spend together at home, and be thankful and be proud of yourself. Oh, he stayed at home till this date. We had these many memories and happy times together at home. So again, just trying to find a balance, and in that way you can turn guilt into something like reminiscence, like memories, by trying to find a balance.
It's interesting. We all talk about retirement planning. This is like mental health planning.
Mm-hmm.
And I really know I am going to listen to this again and send it to everybody I know, because you talk about balance. I love the little math thing, the algebra thing, or the division thing, and the what about me. And I love that Rebecca gave a history of this.
Mm-hmm.
This is a caregiver is a new defined job role.
Mm-hmm.
And it's not like in fourth grade when you did the poster all about me, you said, I want to be a caregiver when I grow up. So everybody's learning here. And more people are having to take that role. But I cannot thank Monica, Melissa, Tammy, and Lisa, certainly, but also Rebecca and Sarah. And thank you so much, and be safe and have a wonderful evening or afternoon if you're on the West Coast.
Thank you.
But
Thank you.
Thank you, everybody.
Very much.